So I'm curious to know, did you study in the early days how products that are designed by American, European, or Japanese companies in the healthcare sector solving specific problems? Did you have a look at that, and what did it inform you? What were your takeaways from
So I never studied any of it. And I got to understand that there are things you can study to do all of this much later, when we had our products out, and when in fact we had some uh, gurus, I must say. I was very fortunate to work with one Dr. Lawrence Faulkner. So he's a trained doctor, but I think he was born to be an engineer. And I happened to work with Mr. Arvind Prasad, who's again a thought leader. So these people, gurus who came in at a much later stage, really, are the ones who uh, opened up the world in the sense, tell us what other people are doing, and then we could look back at our systems and see where we had reached. But till then, we were growing very organically. The interesting part, in fact, is that we realized that a lot of best practices and the right rules kind of things were organically built into our products, just because that was the best way to approach that problem. So we would have failed, learned, read something, possibly on a mobile phone or in a net cafe at that time. But yes, I we didn't formally study that or receive any training.
So that's really interesting, because when you I think when you move ahead, you start seeing similar products that come into the space and stuff like that. So my follow up to that question would be, when you consider doing when you consider designing product solutions in the healthcare space for India, for example, how does that solution differ from when you are designing it, say, for example, an American market? What are the constraints that you have to work with in an Indian context vis-a-vis the or versus the constraints, or the no constraint, or the unconstrained effort that you might have to put in to build a product for a Western market or something like that? What are the differences?
Right. So let's start with the Indian market. The principal problem that I see in India, of course, the opportunity sides are numerous, but the principal problem here is that I believe not many people are able to really assess the value of a software system, right. So there's one system and there'll be another copy in any shortest possible time, and people make decisions purely on the cost of the product. And there's very little investment into what it actually changes on the ground. And a vast majority of health tech decisions in our country are really made for the administration, not for the doctors, not for the nurses, and mostly not even for the patient. So they are essentially reporting and feeding tools to top level management, not really systems which can change the experience of delivery in a fundamental way. So those are the two major challenges that we see in the Indian market. In the Western market, if you leave US and you look at all the other spaces, they are again living in stone age when it comes to health tech. So we visited several different countries to assess what kind of technology are they using and what are the capabilities, and we were shocked. We had frustrated doctors, frustrated nurses, each one of them very enthusiastic about moving forward, but working with systems which in 2020 we had a hospital which was working on a HIS which was deployed in 2001. Zero mobile capabilities. You can access data only from within the institution, and it comes with so many restrictions that at the end of the day, any of the innovations are basically ruled out. People are just letting things continue the way they are. US, of course, is fundamentally different. That's the market where all the innovation in health IT is happening and adoption is very, very quick. And really, that's the space where you have to really put value on table to be able to move forward.